Hai, Assalamualaikum warahmatullahi taala wabarakatuh. My name is Tuan Nur Aisyah binti Tuan Muhammad Rani and I am from University Malaysia Terengganu. So I will present to all of you about my title. So my title is about the formulation of health diplomacy relations of Malaysia framework. Okay, so we move for the abstract. The coronavirus disease, or we call COVID-19 pandemic, is one of the most devastating disasters ever experienced in the modern history of the world. So before this pandemic existed, Malaysia international relations in a multilateral or bilateral manner were very good and got an agreement on a policy. It seems that the impact of the epidemic is not just in the health field, but also in the international economy and politics. This pandemic control will be easily targeted if easily connected through international relations and as a public health tragedy. So for the literature review, easy refer for 5 keywords. First is relief humanitarian, second is COVID-19 relation, third is foreign policy, negotiation, and the last is international relation. Okay, for my research, for the research problem, I have 4 points. The first is the weaknesses of Malaysia health diplomacy relation with other counterparts. Second, instability of diplomacy method used by Malaysia to ensure the successful of COVID-19 issue. Third is lack of specific cooperation between Malaysia within other counterparts regarding COVID-19 pandemic. And the last for the research problem is lack of health cooperation of Malaysia towards COVID-19 in international diplomacy. Okay, for the research objective, the first is to strengthening Malaysia bilateral cooperation within respective nation rather multilateral. Second is to identify contribution as a result of Malaysia bilateral relation in dealing with the COVID-19 issue. The third is to explore health cooperation on an international level with regard of the COVID-19. And the last for research objective is to impressively establish Malaysia COVID-19 diplomacy initiative. Okay, so we move for the methodology. Okay, for the methodology, I have used qualitative method research. Okay, we have two data. First data primary, which is from interview for those from the agency or focus group. Okay, secondary data, I use data from the journal publication or non-publication, article, newspaper, magazine, and report as well for the systematic literature review. Okay, content analysis is by transmitted oral to text and recording system. Okay, for the respondent, for this study, I have chosen as the decision maker in the field. For example, ministry respondent from the Ministry of Foreign Affairs and Ministry of Health. Okay, so we move for the discussion and result. The conceptual framework goal is to rationalize Malaysia health relation in terms of foreign policy. So to harmonize Malaysia in relation to COVID-19 through international health consensus collaboration. So Malaysia strengthen international relation through cooperation to tackle the COVID-19 pandemic. So diplomacy is the best tool to build and strengthen the national health foreign policy through the formation of the health diplomacy framework. The commitment among the respective counterparts nation toward the COVID-19 negotiation process in order to liberalize health diplomacy and foreign policy of Malaysia to assist of the method of COVID-19 humanitarian, vaccine assistance, health expert, transfer knowledge, and the harmonization of COVID-19 environment. So strengthen the relationship of diplomacy through the role given by diplomats through expertise in negotiation and convince communication that touch on the rule at the unilateral, bilateral. Okay, for the advantages for the framework, the first is to strengthen the relationship of diplomacy. So Malaysia cooperation with the UAE, for example, in the collaboration of vaccine assistance in early 2022. So UAE contribute vaccines impact effectiveness of Malaysia effort towards addressing the COVID-19 pandemic as well as diplomacy ties. Okay. The second advantages is strengthen national cooperation. So effective political management and pandemic management from World Health Organization as well as support from the global work as the collective effort to ensure optimal handling of the COVID-19 pandemic does not affect the cooperation previously established with foreign countries. So the last advantages is to benefit any country. So from the vaccination program approved by the Malaysia government, for example, assists the country in contributing significantly in dealing with the COVID-19 cases, even though the fight has not been declared win. Okay, for the novelty, this framework does not yet formulate current. So this framework serves as Malaysia diplomacy relationship to remain strong for future cooperation and benefit its member state. So the last is my conclusion. So through this study, it found that the main problem of the international pandemic is there needs to be a new foreign policy by the global head. So all these problems can be resolved by negotiation Malaysia, especially with foreign country in the fight against the COVID-19 pandemic. So that the effort to praise Malaysia as the catalyst for the World Health Policy. So even if Malaysia and other countries rise through this pandemic, there will be other global health challenges. That's all. Thank you.